Let's go to Dr. Julie Morita on all of this, a member of the CDC Advisory Committee, two of the director of Robert Wood Johnson Foundation, Executive Vice President. Doctor, if I could start out on a more general question, if you don't mind. Some confusion as to whether COVID is here to stay. Many medical experts with whom I talk are saying that it will become part of our lives, much like the annual flu shot. Where are you on this?
Yeah. Hey, Neil, thanks so much for having me today. I think it is possible that COVID is here to stay. It's not clear for certain, but it does look like that's possible. What I would say, though, is when people are raising this question of should we just accept this as the new normal, is that what we're experiencing right now with Omicron is not something that we want to accept as the new normal. We have incredibly high rates of disease, with many people being hospitalized and even young children being hospitalized at this point, and it's not something that we want to be living with. We really need to optimize the interventions and make sure that people are getting vaccinated and doing everything possible to minimize transmission and minimize disease.
Now, with Omicron, one of the things I find so startling about this, doctor, and I'm sure you asked it a lot, we had 4 million cases in just the past week versus 4 million cases in the first 6 months of the pandemic itself. Yet we're told that the overwhelming majority of these cases are relatively mild, at least by comparison. Do you agree with that?
Yeah, I mean, that's what the data are telling us right now, that there's this incredibly high surge of diseases, of people getting sick. But when you compare the number of cases to those that are being hospitalized and those that are dying, the numbers just don't compare. It's really clear that people aren't getting as sick, aren't getting hospitalized like they did in prior waves of the pandemic. That's not to say that this isn't serious, though, because the total numbers are so high of people getting sick. Our hospital systems are really, really stressed, and we have to take this seriously.
You know, this new variant, IHU, I guess it's called, doctor, should we be worried about that?
I mean, I think with throughout this pandemic, what we've seen is the emergence of various variants, and it's critical for us to keep a close eye on them and to look at the first question is how transmissible are they? The other question to ask is how bad is the disease that they're causing? Is this causing really serious disease? And then the other question to ask really is how effective are our treatments and our prevention measures in preventing transmission of these variants? And so it's important to keep a keen eye on what's happening and what's emerging, but also to answer those critical questions so we know how best to respond.
You know, Doctor, Moderna's CEO was saying that there may be a need for a fourth COVID shot. This comes at the same time Israel has instituted an additional booster, so 4 shots in all, to deal with, I guess, everything from the original COVID and Delta and all the rest, and now to Omicron. But where does it end? How many shots? How many boosters?
So, Neil, this goes back to the question that you asked me originally: is Omicron, or is COVID here to stay? And I think we don't really know the answer to that question. If the virus does seem to continue to circulate and we have new variants that are emerging, then vaccination may become part of our annual routine, just like flu vaccine. But I think it's too early to say that at this point. When the Moderna CEO is talking about a 4th dose, it could be we're talking about additional boosters of the same vaccine, but it could also be about a different form of the vaccine that protects against different variants. And so I think at this point it's merely speculation, and it's too early to really make that call.
Dr. Morita, very good catching up with you and answering all of these obnoxious questions. I just wanted to know, and you had answers for all of them. Much appreciated. Thank you.
My pleasure. Thanks, Neil.
All right, Dr. Morita on all of that.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.